name is Penny Peterson, and I am the new executive director for the foundation. I don't know how many of you happened to see the article in the Ketchikan Daily News on Monday, but the headline was "Hospitals Expand to Keep Up." And that previous slide that Pat just had up showed you that not only are we needing to upgrade, but hospitals and nursing homes all across the state are doing that. And I believe that $300 million for 2011 is even low. It's even higher right now. I think we did a quick survey with the Alaska Hospital and Nursing Home Association, and we're getting close to that $500 million target. So with that previous slide also, and with what you saw in the article, it's different for each community what those critical areas are and what those strategic areas are. Because when you build something for a hospital, you want to build for the future. We need to address the critical needs that we have right now. But we also need to look the 20, the 30 years down the road. And so here's our piece of the pie. This is the addition project proposed for the hospital and endorsed by the city. I believe all of you now know, hopefully, we're trying to get the word out. Most people didn't know that the building and the land that the hospital is on is owned by the city. Peace Health Ketchikan Medical Center operates the healthcare services, is the operating company within that building. And so we partner with the city. And we have done analysis on what our critical needs are, and you know them. It's access, right? How long does it take for you to get to your primary care physician or any physician? And when you have that unexpected illness and you need access and you call for an appointment, can you get in? That's your most critical need. In addition to that, we also need to be able to have updated surgical care and physicians, updated current surgical physicians in orthopedics and general surgery to be able to perform those critical needs when we need them, as well as the future phase of healthcare with joint replacements and unplanned surgical procedures as well. So this is the view of the proposed addition. This is phase 1 of 4 phases, and this is from the view of Tongass Avenue, looking towards town. And down below you can see there is a parking garage. The 3 most critical areas that we have identified are surgery and clinical access, clinical office space, and parking, covered parking preferably, so that you have access even to the building. This would sit right about where Carr House is, so Carr would need to be relocated to a different spot. It needs to be relocated, it needs to be upgraded, and so this building would sit right in front there. I also want to make note that the parking area, first floor is surgical area, and the top floor would be the clinical space. Why those are critical? We're very blessed to have NAC Architecture on our staff, or not staff, but contracting with us for this. They specialize in healthcare architecture, and Dan Jardine in particular has dedicated the last portion of his career to specializing in surgical architecture. So while we are not increasing the number of surgical suites, we are creating them. Oh, thank you.
You're welcome.
Thank you. You're doing great. You're looking really good. We're creating them to meet the needs of the future. We're going to give you a glance of what our current surgical rooms look like. They are from 1963. Imagine, okay, women, imagine that you have not upgraded your kitchen since 1963. And that's what our current operating room looks like right now when you have all this staff around. And you remember, you need to keep surgical sterile space. And so if you're walking around in the room, how tight that is, especially when you're having a delivery and you even have more access there.
Remember, your hands can never go below your waist. Surgical is walking this way. So everything from waist down is contaminated. In a cramped environment like this is critical.
If you reach over.
Okay.
So that's that. Our current building is a concrete structure with fixed floor to ceiling head height. Currently, right now, we have a 10-foot ceiling, and we need to have a 14-foot ceiling. So many of you might ask, why are we doing an addition rather than a renovation? That is number one reason, because we can't renovate the current concrete space. You can't take the load off. So it's also, number two, it's really, really difficult to do surgery when you're trying to renovate the space. And we absolutely have to keep constant surgical access at all times. So that's why we have the addition. Now, if we had a 14-foot ceiling head height and standard 500 square feet of surgical space, that's what that space would look like, as opposed to that.
The table is smaller than that.
And there's no staff. It's a miracle.
I know. It's kind of like those real estate photos where they really clean it up to make it look bigger. No, but truly, it's also, I mean, ask Peter Rice, it is a definite recruitment and retention issue as well. We're not going to sugarcoat that. In order for us to recruit and retain the physicians that we need in our community, we're going to need to upgrade from 1963. The second part of the addition, as I told you, was the clinical office space. Right now, many of you have difficulty getting in to see your physician, or getting your child in to see, or do they have strep, don't they have strep? Those same-day calls are really, really difficult. Part of the inefficiencies that we have is not because we do not have enough physicians to address the need. The problem lies in that we don't have enough space so that they can work efficiently in that space. In terms of both surgical areas and clinical space, what we're trying to do is increase capacity through increased space to make us more efficient. As you heard in the front slide, we need to increase our resources, which we do. We have no shortage of patients. We have room for growth. However, what we need to do is be more efficient, and space capacity is the way that we can do that. Where's my clicker? Oh. Sorry. Eyeglasses. This is the floor plan. And just to orient yourself, this is the addition down here, this great big rectangle. And this blue hallway here is the infamous thoroughfare in the current hospital. That's the public thoroughfare that you can walk from the emergency room entrance all the way down to the front waiting room. And at the same time, you can meet your friends and neighbors too that also are going down on a gurney. You know, so within this addition renovation, we certainly are looking at those issues of privacy, so that you don't have to go walking down or wheeling down in your gown on your way to pre-op or post-op with your friends and neighbors watching you. We're trying to get an efficient sense of flow, and we also want to keep our surgeons in their clinic right next to where they are in surgery. Again, when we look at our addition, we're looking at it strategically and how we can increase efficiency and services for you. And here's the third floor. I'm not an architect, but we have a centralized layout, and so we also, this is where you would come up from the parking lot area, right in a center waiting room, and then you can go to the various clinical areas. And we've also included in here for the visiting physicians that come. Right now they don't have their own space, and they kind of get pigeonholed wherever there happens to be space. And this way it gives them a dedicated area. The other thing that's crucial, again, in terms of efficiency, is that we have one central administrative area that's able to service that whole clinical space.
You bet. Go ahead.
Yeah, one of the main problems that I've heard people talk about in this community is for immediate care, not emergency care, but immediate care is being driven into the emergency room. And, you don't need to be in an emergency room, and it costs a lot more money to go there. Will this new addition alleviate that problem, or is there something going to be done about that?
You could have done that better if you were a plant. It's a perfectly staged question. This is what we're addressing in our community. You're right on the money. Nobody wants to call into the clinic. There he is. Hold on. I saw out of the corner of my eye somebody leap to their feet and ready to answer.
Well, this has certainly been a topic of discussion in the last few years, not only with the community, but with us at Peace Health. And I did make some comments about this very question at the AARP meeting last week, but we have started tracking our referrals from primary care to the ER, because this is a big challenge and problem. And again, that the issue for us is having adequate number of primary care docs, plus some of the limitations we have with the number of exam rooms and just getting people worked through. Anyways, our tracking system, back to that. So after we first started focusing on this last summer, we were running about, backing up, we have 700 primary care visits per month. And so we were running in July, before we started some process improvements, about 12 people going to the ER. And then in the fall, we've been going anywhere between 5 a month, and then our best month was 2 per month. And we did bump up a little bit in December because of vacations, but it's something we're constantly working to improve and hopefully eliminate, because we totally get your pain. To go to the emergency room for treatment of a urinary tract infection is really a poor use of resources, and if we can at least keep it to 5 or below per month out of 700 visits, I think that's certainly better than it could be. And our goal is to have it to be 0. Okay.
Can you talk about extended hours?
Oh yeah, and one of the many challenges I think for people to get health care is not only when can they get that appointment, that urgent appointment, but what time of day are those appointments available. And so we've actually been planning this for quite a while, but we're starting our evening hours in March. So Mondays and Wednesdays will be open until 7, and that'll help people who have trouble getting off of work to go see the doctor, and or maybe getting their kids during school time.